Our greatest enemy right now is not the virus itself, it's fear, rumors and stigma. And our greatest assets are facts, reason and solidarity. The World Health Organization Director General Dr. Tedros Adhanom Ghebreyesus made the comments at a briefing on Friday when the group raised its global risk assessment of COVID-19 to very high, its highest level. With nearly 60 countries affected in just 2 months' time, fear and finger-pointing have also spread. Is this blame game a legitimate one, either in terms of the origin of the virus or the competence in containing it? I'm joined from Durham, UK by Thom Brooks, Dean and Professor of Law and Government at Durham Law School, and from Hong Kong by James Chau, Goodwill Ambassador of the World Health Organization and also host of the China Current, a leading digital show about our global future. Gentlemen, welcome to The Point. First of all, let's take a look at the trend of the development of the situation as of March the 1st. We first see cases in China continue to drop. For that day, the latest number of new coronavirus cases, 580. Compared to outside of China, new confirmed cases is more than double. It's 1,100 new cases. So we are seeing two lines here. The blue line is the China trend trajectory, and the rising red line is what the situation is like outside of China. So let me go to James here. Now, as I mentioned, Dr. Ghebreyesus said, now our greatest enemy now is not the virus itself, but fear, rumors and stigma. And he said that at the beginning of the outbreak. He's repeating again. Why do you think he needs to remind people of that, exactly what are up against?
Well, thank you, Lucine, for having me back on your show. And, you know, Dr. Tedros, if you work with him, you know that he really is a very positive, forward-looking person. Remember many times where he'll say, just think about what the goal is and how you're going to accomplish it. So I'm not surprised that he talks about the danger of stigma, but he emphasizes indicators like science, like facts, and like compassion, solidarity being the weapons that we have. We're dealing not only with a war against a completely new virus that a couple of weeks ago none of us really knew anything about, but we're also dealing with a war on misinformation, on rumor. A lot of it is deliberate as well. So he understands very well that we're fighting these fires on multiple fronts. But of course, the World Health Organization is the world's leading health body, but it needs to do that with everybody. It needs to do that with the member states, but it also, most of all, needs to do that with the people. So I think it's another timely reminder from him to keep focus on what is ahead of us, and that's the point that we all need to reach together in a very inclusive approach. It's not just about China as we see now. Unfortunately, it's now encapsulating almost every part of the world. And so I think his reminder to gather together as a coalition for solidarity, for humanity, is a very, very timely one.
Right. However, we are seeing headlines which are not talking about solidarity, but rather finger-pointing or blaming countries such as China, or I've seen countries such as South Korea being blamed for, for having seen an outbreak. And I have received emails, I have seen people leaving messages on me, on my Twitter account, saying either China should apologize to the world or China should compensate to the world, either for ostensibly the origin of the virus or its failure not to contain the outbreak in the early stages. So, Professor Brooks, how do you look at these kind of rhetorics and this kind of attitude? Is it really the time to do this kind of finger-pointing, this kind of blaming games?
No, it's not. I mean, so it's understandable that there's a lot of people very afraid, very worried about a new virus that seems to have no cure. Something a few months ago, as your other commentator noted, no one really knew anything about. And it's led to a lot of people being ill and a lot of people dying as well related to this virus. So it's understandable there'll be a lot of concern that people will have. I think that the thing to do right now is not to be so worried as much about how exactly things started rather than dealing with the problem. So there's a problem. It's not just one that is in one part of China, but it's spread to many parts of the world. And everyone needs to come together right now to find a way of limiting the spread of this virus, hopefully containing it and tackling it. And then, you know, how could things be handled better or differently in one country or somewhere else? Those are things that can be worried about, I think next. The first thing that needs to be done is to get a handle on this right now, because at the moment we're seeing, you know, every day there seems to be more countries where people are coming down with this virus and contracting it, not traveling at all anywhere. And so that should be the pressing problem in the public health emergency.
I absolutely agree with you. However, we need to also make this clear, for instance, concerning the origin of the virus. At this moment, there is no scientific conclusion, but the outbreak for now, according to current knowledge that we have, did start in China. So, James, tell me this. Even if the virus came from China originally and it's been scientifically proved, should China be blamed for it? Just like tell me if my comparison is appropriate. Just like, should African countries be blamed for Ebola, or America blamed for AIDS or swine flu?
Well, unfortunately, Liu Xin, you know, virus is unfortunately, very unfortunately, a matter of course in our world today. We knew a long time ago that another global pandemic or epidemic was going to emerge. We didn't know necessarily that it would happen in China. And the fact that it happens in China is, in some sense, in this particular context, of secondary importance, because it could happen in any part of the world. We live in a globalized, in an interconnected world. So more so now than ever, the concept of borders, as we once understood them, at least in our parents' generation, or even when we were children, it's not so relevant today. It could have happened anywhere. In some senses, I think it's there is an advantage that it happened in China because there was a policy from the government to be able to lock down those cities and to be able to deal with it. Whereas I would worry that in some other countries, not necessarily just third world countries, even first world countries, where the health systems won't be able to support not only the regular health needs of its own people, but also in terms of the outbreak. Do they have the diagnostic testing kits? Are they able to get people to go over there? Are they able to quarantine people? Do they have the facilities and the know-how to be able to carry that off? So in a sense, you know, we are one human race. In a sense, you know, what passport we carry, how we look, or where we happen to be born is really not very important. It's going to affect us, you and me, in exactly the same way, if, very unfortunately, we were to be infected ourselves. So I don't think that's very helpful in terms of finger pointing and blaming. What would be helpful is to get rid of that distraction and, as I said, to really focus on the job that really still needs to be accomplished.
Right. Well, for now, for China, when it started, it was a new phenomenon. It was a completely new thing. But for many other countries, actually, they have been observing for something like a few weeks, even a month, how China has been finding out with this virus, how China reacted. And yet, when the virus eventually spread to their country, from the bits and pieces that we're reading in the press, it seems that governments are still, some governments are still pretty badly prepared, and numbers are spiking. So some people would say, why are these countries not better prepared? But let's hold our tongue. Is it really the time for countries to look at their own governance loopholes or to point fingers at each other? James.
Well, I shuddered a little bit when I heard you talk about countries observing, because I think there's been probably a bit too much observing and not enough doing and preparing. We weren't prepared for this outbreak. It's completely new. In a sense, there is an advantage for other parts of the world from what the situation, how it's unfolded in mainland China. I think what they can do and what's going to be useful over here is, first of all, to issue very clear and calm directives to their communities and to their populations, and to keep it consistent. If the message keeps on changing, then people are simply going to go to social media, be it Twitter or be it WhatsApp, and follow their own advice or that their friends are passing to them. I think you need to protect your health workers. You need to make sure that as much of the supplies available to them is made available to them. But I think also you need to mobilize community. You need to identify who those community leaders are so that the community is empowered themselves. You don't just tell them, wash your hands and don't shake hands, but you really show them why it's important so that those behaviors become ingrained at community level, so that they begin leading the response at that level together with political leaders.
Right. Let me go back to Professor Brooks here. We were talking about the challenges of handling a virus in today's day and age. How do you look at the challenges that any government would face or any political system would face, whether it is a liberal democracy or whether a Chinese political system? The virus is going to spread, and there is no compartmentalization in today's world where nothing gets spread to other parts of the world. Professor Brooks, your thoughts?
No, I certainly agree with that, and I agree with the view that a lot of countries, certainly outside of China, have done a lot of watching and not a lot of acting. I've just returned from a trip to the United States. I was in Chicago, and in flying out to the United States, they were checking to see if anyone had been to China and preventing people from going to the United States who'd been there the last 2 weeks. However, the virus is in lots of other countries, dozens of other countries outside of China, where people could be infected, and they were going through. That was not very well prepared. On arrival in the United States, and then as I came back into Britain via the Netherlands, there was no checks on anybody. There was no
Why do you think is that, Professor Brooks?
There being lots of public announcements
It
by
really makes me
various
curious.
ministers.
Professor Brooks,
yeah.
Why do you think is that?
Yeah, well, I think that they're really not prepared. So your question about, so what about other types of governments? How would they handle this? Apparently not very well. When I arrived back in the UK, the airport's coronavirus advice was to just, wash our hands when we're using the toilet, and to use a tissue when blowing our nose. There wasn't any deep clean, there wasn't any checks on where people were coming from, there was no check to see if anyone had any fevers and other types of things. Effectively, there wasn't really anything being done whatsoever about people here. And so the thought that other countries are somehow better prepared or doing more action than in China or somewhere else certainly doesn't seem to be true from the 3 countries I've been traveling through in the last week.
Well, certainly we hope that the situation will change. That's also what I have been hearing about. Many thanks to my 2 guests, Thom Brooks, Dean and Professor of Law and Government at Durham Law School, and James Chau, Goodwill Ambassador with the World Health Organization.